Hi, this is Steve Bell, and welcome to the Medtech Mavericks podcast. Today, I'm delighted to have with me a veteran of the industry, which is Greg Roche. And Greg's going to give a little bit of his background in a minute. So, hey, Greg, nice to have you here today.
Thanks for having me, Steve. It's great to be here.
Great pleasure to have you. So, for any of the listeners that don't know, can you give us a little bit of your background story in medtech and what you've been doing so far?
Yeah. So I'll try to keep this under a minute, but I have a unique educational background. I came to MedTech with a law degree. So, and I came to MedTech in 2005. So I started with Stryker in their endoscopy business. So minimally invasive surgery is very familiar to me. It's a bit of a coming home, coming back into soft tissue robotics. I spent 8 years with Stryker. Sales and sales management with endoscopy, and then I ran their captive finance strategy commercially, and also ran their larger account strategy in the U.S. So did that for 8 years, and then transitioned to Zimmer Biomet, or Zimmer at the time, and became Zimmer Biomet. I built a commercial organization for them around their surgical business. Their surgical business is large adjacent capital to orthopedics, so fluid waste management, power drills and saws, tourniquet machines, things like that. Had an opportunity to then run that business. We had a lot of success. We actually took the commercial organization from 6 to about 130 in 5 years. Had a ton of success, and had the opportunity to run that business as president. And then we acquired Medtech, which at the time was a neuro robot, as you well know, out of France. And we had the intention of converting it to a knee robot. And so I kindly asked my CEO if it was appropriate for me to run that business, and they gave me that opportunity. So I was blessed to launch ROSA, which was, I would put numerically against any launch. We had a ton of success. I had a ton of success in the ASC, so a lot of learnings we can talk about there. And then in 2021, I got a call from Avatera, which soft tissue robotic company out of Germany. Was there for 2 years to put my learning hat back on, and again fall deeply into the space. And then last summer, I got a call from DistalMotion, and honestly, during my diligence, I realized that this was the culmination of everything that I just told you. This made me really, I felt it was a perfect marriage, and so I took that opportunity November 20th, and I've been here since.
Perfect, great, excellent. Yes, that's quite an arc of a career, and again, you've got a lot of different backgrounds there, from the minimal access sort of laparoscopy side all the way through, and with the Rose is very interesting product. Rose, a very good product, because you cut your teeth in the robotics. Interesting to talk about the ASCs, and we will dig into that a little bit today, because I think there's a big story coming there. And then Avatera, so you got into the soft tissue robotics, and then you kind of go full circle with laparoscopy and soft tissue robotics by the DistalMotion. So yes, tell me a little bit about just your move back into the soft tissue surgical robotics. So that's where I'm kind of really fascinated in. Just tell me a bit about the two companies and the thinking processes.
Yeah, I think, Steve, maybe you and I agree. I don't want to put words in your mouth, but what I do believe is that there is so much room for competition in this space, and I think we'll talk a bit about the market. But when I first got the call to enter back into the market, I was so pleased, because the opportunity to me is so vast. It's very rare that you find a market that has really one dominant player, and just such a yearning or need, because there are a multitude of reasons why soft tissue robotics hasn't expanded, whether that's site of care, geography, type of hospital, type of surgery. So to me, I just saw this great opportunity. I always like to push boundaries with roles. So running a company in East Germany was definitely a way to push boundaries for me. So in doing that from the US, was obviously from a, was a challenge in itself. But again, it was a great opportunity. And then, we'll talk about DistalMotion, I'm sure. But as I did my diligence with DistalMotion, just the maturity of the company, I was actually incredibly surprised. And I think it was because of the lack of marketing at the time for them intentionally. I just had no idea how mature the company was, where they were and where they were going. So again, it was my desire, I think, to be, I like being the underdog, so to speak. You might feel the same. But I also just saw just massive, massive opportunity to help patients, to help providers, physicians access robotics when they've never been able to do it before.
Yeah, no, I think you've touched on a lot of things that are dear to my heart. And again, the underdog story is always a good one to come from. It's got its challenges, but it's also quite an exciting place to be. I think again, you said something to me there, which I give credit to DistalMotion. It's very easy to crush under your own weight by going out and trying to do too much, too fast, too big, too many markets. And DistalMotion has been around a little while, but they've not gone banzai and gone everywhere and gone absolutely crazy. So tell me a little bit about that, because I find that quite interesting.
Yeah. So this is very intentional. And I'd like to say that this is all my idea, but obviously it was being done before my time. So maybe two different verticals here. One is the technical or the product itself, and then the other is the commercial strategy. On the product side, there are two things that happen once, getting a robot approved, as is half the battle. Having the robot be predictable and sustainable in surgery is the other half. And this is, again, one of the things that I loved about DistalMotion. They spent the time before expansion to do two things. One is product iteration. So again, typically, if from a software perspective on any robot, and again, you see it with Da Vinci 5, they're doing a limited launch. You have this iteration of software. So you build in safety mechanisms, probably over-engineer safety mechanisms, and then you start to release those over time. So you understand what you're doing. And again, being a startup, I shouldn't even say a startup now, but being an early stage company, that iteration can happen really quickly. So you have this technical development curve, which from CE mark until middle of last summer, that's what Distal was doing. And then the other piece is this clinical development. So simple things, port placement, how do you approach each surgery? And you need great partners for that. And you shouldn't really expand wildly until you do those two things. So that's the first piece. The second piece, as you know, from I think your history, you can overexpand and you can really burden your P&L, from a commercial perspective. And we wanted to make sure we knew exactly where we delighted the customer, how to drive utilization in a positive way. So we're very focused right now in Europe, in 3 countries, which is Switzerland, Germany, and France. And then, over the course of the next year, we've got a couple things that are very beneficial from a profitability perspective. So as we hit those milestones, we'll start to release that curve, and then serve the other markets in Europe. So as much as we want to do that, we also are in this for the very long. And so we're being very mindful about how we approach the market, and again, understanding what customers love about Dexter, how we approach each surgery, and then as we're running a business, how we can drive value to the customer and also make a profit. So a lot going on, but again, we're being, I'll say deliberate is a great word about how we're approaching our commercial strategy.
Yeah, and with hindsight, I don't think that's probably a bad choice, to be honest.
Yeah.
I think it's good. I mean, ultimately, though, and again, Distal is a European robot. Where I was at was a European robot. Avatar is a European robot. And one of the things, that people often say is, well, that's fine for those European countries, but, USA is a different market. But I mean, you must have some plans to actually eventually be in the US.
Yes. Yeah. So, I mean, we've submitted our de novo. So we're on the pathway. We've had a great partnership so far with the FDA. Um, and we feel very positive about the outcome. So, we'll continue to work down that road. But the other thing I think when we think about the U.S. market is we really and again validated. We had a lot of feedback sessions here at Sages in Cleveland last week, and a lot of validation about our thoughts of the ability to complement some of the current systems in the market. Also, the ability to go to new sites of care based on the form factor and some other things that we'll talk about. So the U.S. is a priority market for us, and we believe that the uniqueness of Dexter will allow us to commercialize there in a healthy way.
I think that what you were saying there, it strikes a very big chord with me. That there's not just one solution, right? There's not just Da Vinci 5 or XI or whatever, not just intuitive. And I think they do a great job. I think Da Vinci 5 is spectacular. But is it the right robot for every procedure in every location for every surgeon? It's something you and I have talked about a little bit before. I mean, give me your perspective on where you see this kind of like spectrum going across the procedures. It can't all just be Da Vinci 5, right?
Yeah. So the analogy I use is if you're driving to Starbucks, a Formula One race car may not be the right mode of transportation. Sometimes you can just take a Porsche, so that's the analogy. But I think I put it into kind of three categories. So you have these large form factor, what I'll say are closed systems. So these systems include visualization, perhaps advanced visualization, a robot instrumentation. Likely they've got some digital or AI strategy, telepresence. So it's an all-encompassing system, an ecosystem. And most of them are fairly large. Okay, and then you have some that are smaller form factor that are closed, and then you have where I would put Dexter, which is open system. So again, we're very focused on the robot itself, making a world-class robot and world-class instruments, and but a small form factor. But when I say open, what I mean is you can choose your own visualization. So if you have a visualization preference, obviously those visualization systems come with advanced visualization, ICG, MSI, some of those technologies. And again, we partnered with Proximie for telepresence and what I'll call data infrastructure. And so there's a lot of different philosophies. The other category I would put is like the solo assisted, or maybe you have some niche players. So like a Moon, in my opinion, or you have virtual incision or some of these other things where maybe they're not going to cross the entire spectrum of soft tissue surgery, meaning urology, gynecology, and general surgery, and thoracics and others, but they're built for procedural specific items. So that's where I see the market right now. And again, I think when you look at the robots that are even coming, you can put the robots in one of those three categories. And really, to me, the market needs them all. The market needs them all.
Now, a lot of people who are listening may not actually know too much about Dexter in itself. And, one of the unique things that I always talk about, or I think about with Dexter, is that, you're sterile when you're at the controls. Can you just tell us a little bit about, again, and I'll try and flash some pictures up of this as I do my post editing, but tell me a little bit more about Dexter so people understand what it is.
Yeah. So again, small form factor robot, and you're right. The surgeon console is sterile, which is unique to our space. There's not another robot where the surgeon has the accessibility to the patients that they would, they would not have with other systems. And where do we see that's a benefit? So, today, I'll give you just a small anecdote, and I'll tell you where I think it helps immensely. We see surgeons doing things they're comfortable with. So for in inguinal hernia, for example, very easy to do the 95% of the procedure on the robot, but it's just easier to put the mesh in laparoscopically. So it takes the surgeon seconds to walk over, move the arm away, and put the mesh in and then go back and suture, which is obviously the benefit of a wristed instrument, is the ability to dissect, work in confined space, and suture. So they use the robot for everything that it should be used. The other thing I would say is comfort, right? So we talk about, if you have to bail on a robotic case, it's extremely difficult. With our system, very, very easy. So there's a massive safety benefit from the ability, again, just to quickly get to the patient. And because of the form factor, you're in there within seconds. The arms move away in less than 10 seconds, and you can operate in a laparoscopic format. The third vector here is training. So when you think about teaching and training, the ability to have residents and fellows, in the field, out of the field, still having access to the robot, you can almost teach multiple modalities, which is fantastic. But it also allows surgeons to learn in a quicker way. And what I mean by that is, we had a great example of a surgeon starting with maybe 40% robotics, 60% laparoscopy. And then you could see them moving 50-50, 60-40, and then all the way to 100-0. But it gave them, they were able to do it at their speed. So there's massive benefits of this. And quite frankly, we think, longer term, with a few more R&D upgrades, that it could really help with a solo surgery if they wanted to do that. Again, enhancing that outpatient surgical center strategy that we have in the US and in some parts of Europe.
So let me take two pieces there. We'll come back to the ASC in a minute, and some of the clinics and outpatient departments and places like that, which have got a crying out for many reasons to go there. But let me go and talk one thing back, because there's a lot of, I wouldn't say confusion around the world, but there's a word that gets bandied about sometimes, and maybe you and I both think it's probably not the right word to use now, which is hybrid, right? You hear hybrid a lot. And when I've heard people talk about Dexter in the past, they said, oh, that's going to do hybrid, which is sort of not probably the best word. But I'd love to get your thoughts on that, because you probably hear that now and again.
Yeah, funny enough, that was one of the words that we made sure it was not really around our talk track, and I'll tell you why. With Dexter, you can perform a robotic surgery 100%. And I think that was, even sitting in a competitive chair for the 2 years prior, was a misunderstanding that I had. So when you get into a surgery, you can do the entire procedure robotically. And I think of a hybrid solution as one in which you would do a portion of the procedure robotically. So, and we had, marketing that maybe even this term on demand, it wasn't the right term for us. So again, we've really moved away from that, because I want people to understand this is a fully robotic solution. We've done almost 1,000 surgeries. We'll hit 1,000 surgeries next month in Europe, in those 3 countries that we mentioned, and we've done 35 different types of procedures. And it would be an injustice to say that Dexter is a hybrid solution, knowing what I know now. So I don't know if you have an opinion on that term, or.
Yeah, I think for me, I mean, it depends how you want to define hybrid, right? But basically, for me, I think there's no such thing as a pure 100% robotic procedure. If you're doing a prostate with a Da Vinci 5 and somebody's putting clips in manually, technically that's a hybrid, right? So for me, it's like a scale that goes from 100% robotic down to less. And I think what you said was interesting, and I felt the same for a long time, which is giving the surgeon choice and not trying to ram down their throat 100% robot is the smart thing to do. Because people learn at different paces. People want to do, take some adhesion down quickly. Some people just want to do that manually, right? They just want to do it quickly, because it's not that the robot can't do it. It's just makes more sense to do it that way. And I think what's coming out in the next couple of years is common sense, of which bit of the procedure, you bring in and use the wristed instruments and all that, but which bit you just take a regular straight lap instrument and take something down quickly with it. So I'm with you a little bit, which is again, again, I think it's been part of the industry problem that we've created ourselves, is a little bit of confusion around this word hybrid. And really what we're looking at here is giving choice to how much of the procedure you want to do. And you know, I've understood that as well with your system, with other systems, they are 100% robotic capable if that's what you choose to do for that case. But it just might not be the best choice for that particular part of that case. So yeah, I agree with you there. I do want to come back again and talk about choice. So we've talked a lot, and I talked a lot recently about sites of care, because there was a lot of what I would say is lower acuity procedures gone over to main blocks so that they could be done on say, a mainframe robot like a Da Vinci or something like that. And again, that may not be the most sensible place for that procedure to be done. And it also may not economically for the hospitals be their preferred site of care. Tell me a little bit of why you think it went that way, and why there are challenges in things like ASCs and outpatient departments and clinics. Well, what's your thoughts of the challenges of robotics there today?
Yeah, so when you think about, and funny enough, I had this epiphany very early on in my tenure here. Dexter was built for high volume, low acuity with the ability to flex up. And the problem with some systems is they're built for high acuity, which causes this inability to flex down. I mean, clinically, logistically, financially, they're one of those three verticals. But what I see, especially here, reimbursement is more favorable in a brick and mortar hospital for a hernia, for example. But also that's where the robot sits. It doesn't sit in the ASC as a general rule. I know there are some, but not that many. And there are reasons for that, right? So there's space, there's inventory, there's sterilization, there's cost. So you have all these factors of why. I think one of the things that I took away from Sages was both from a surgeon perspective, a patient perspective, there is a strong desire, quality of life and patient experience. Someone said, look, a patient can just pull into a parking space, which we know at a large hospital, that's almost impossible. And then it takes you 30 minutes to get to where you need to be. So there's a lot of reasons, both, from a physician, quite frankly, I think from a provider perspective, because they're going to be able to attract patients with this. So there's all these tailwinds that are happening, but traditionally because of reimbursement and because where the robots really are, the geography of the robots, they haven't done it yet. So again, we feel Dexter's going to help solve that.
Yeah, and I agree. I think there's, and I look at Dexter from the outside, and there's some features of it that I can definitely see. I think one of the things that for me is one of the very interesting things with Dexter, and you may or may not agree, is that there's it's this shortage of staff is one of the problems. Is and having also a good bedside assistant is a problem as well. So there's two problems with that. One is in laparoscopy, having somebody manually holding your scope and doing things like that and doing it in a good way and not making you seasick and all that good stuff, especially with 3D vision. But the second is, if you're a console surgeon with a larger system, having a good bedside assistant is really, really important. Making sure they can put the mesh in, or they can put instruments in or grasp or different things. I think it's interesting with Dexter that you overcome one of those, a couple of those barriers by having the surgeon stay at the bedside, where they can now put the mesh in, as you said before, rightly, on a hernia. You don't need a more qualified bedside assistant with you. So thoughts around that? Is that part of the plan?
Yeah, and it'll get better over time too. I mean, really, there's only a few things with Dexter that bedside assistant would be even doing now, and some of those will be eliminated here over the next year. One of the things too that I think you've been in these countries as well, but there are certain times when you're talking about it, because we've both seen it. Not always, when you have a closed system, does a surgeon prefer the energy device or the stapling device? They actually may have another surgeon in the sterile field. So you can think about the lack of economy in that case as well, by having now two people in the sterile field. So that to me is a huge benefit, and again, there's a lot of reasons why people use maybe a different stapling device. It may be preference. It also may be cost, right? So they have or a clip applier, as you said. There are a lot of different tools that people use where you might have that fifth port or do something a little bit different. All of that, the need for a surgeon to be there or a very skilled bedside assistant goes away. The surgeon can go do it, right? So that's I think a huge luxury, and I actually think over time we'll prove out the economies of that as well.
So let's dig a little bit more into economies, right? So one of the things that, when you ask people, about robotics, the immediate thing is cost, right? So, everyone's going to ask, well, how much is the Dexter going to be and what's the cost model going to be? And you can or can't talk about it, it's up to you. But I'd like to know what at least your thinking is around the economics, because you can see that Da Vinci and Intuitive are going over to kind of more of a lease model. I think it was 78% the quarter before. Thoughts around cost, economics?
Yeah, so I guess number one, what I would say is the lease model or fee per case rental, having the flexibility to allow your customer to access the robot based on the business model is innate in our strategy. So flexibility is really our strategy when it comes to acquisition. So that to me is, I think it's only going to get more and more prevalent. But I still wholeheartedly believe, and this comes from my experience at Stryker and at Zimmer. I built a captive finance business within Zimmer as well, and you have to allow customers to access in the ways that they do, especially when you start talking about these outpatient environments or ASC environments where you have physician ownership. So that's going to be a very prevalent way to do it. From a cost perspective, of course, I look at it as, so now that I've said we're going to be flexible on the capital, right? We're going to try. I mean, we're going to try to boldly drive down cost per case. So that we have to. I think that has to be part of our story and our mission. And over time, I think we'll get better and better and better at that. But again, when you talk about having people be, or having robotics be accessible to the marketplace, cost is a factor. And if so, a lot of people don't talk about it because it doesn't benefit them. But I think it will be a benefit for us.
Yeah, and again, I think if you're going into site scale like ASCs and you're into lower acuity procedures, the margins get thinner and thinner. So you've got to be working on that as companies to try and help the customers overcome that barrier if you want to get the mass adoption. I mean, but I am a strong believer that the train has left the station on robotics. About 5 years ago, I used to get asked, why should I get a robot? I think all I ever hear now is, which robot should I get? Right. So and it's not in all countries and not in all parts of the world, but definitely that train has left the station in most sort of like European countries, in the US, for example. A lot of like Brazil is another place. Where do you predict this is kind of go with the mix of laparoscopic and robotic over the next sort of 10 years?
Yeah, I mean, I had a really interesting discussion with a large academic here in the US, but they have a footprint outside the US as well. And it wasn't if, to your point, it was when. And, the thought was by 2030, in the major markets in the world, it is highly probable that people will only know robotic surgery. Even for these lower acuity cases, hysterectomy, hernia, that's how they'll be trained. So to your point, it's going to happen. And again, based on the geography, it may be a little slower than some others. So the UK may be quicker to adopt than maybe an emerging market, but it's going to happen because of how people are going to be trained. And you hear the examples today already that there are fellows coming out that have to have a robot to do a hernia. So, and again, I think it's our duty to provide solutions that make it both clinically and economically feasible to do that over time. So I think, as you said, the train maybe is now it's out of the station.
It's gone,
And
yeah.
it's not totally to the destination, but we're getting there. We're getting there.
No, I agree. I agree. So again, for some people that they may not have seen Dexter, or where can they find out more information about it? Where can they get to even see? You said you were at Sages, for example. I mean, are you taking it around and showing people in different places?
Yeah. So right now, this is part of our pre-FDA. Just we're getting feedback. In a market where we've not been able to get feedback before, but we do have commercial presence in Europe. So if you're in Europe, we are absolutely, people are able to see the product at multiple conferences. Once we get FDA approval, we'll be much more prevalent in the US as well. We had a very, I think they call it a tech suite at Sages. So we were behind closed doors, and we had a select number of customers that were just giving us the feedback we need to get ready for a US launch. But yeah, it's available. We have multiple showcases in our headquarters in Lausanne, Switzerland. We have different. We do a lot of customer visitation, because I believe actually seeing it in surgery is the biggest testament of what it does. And as I said before, although I think it's going to enable lower acuity, high volume cases. I mean, we did a Whipple last month. We've done hundreds of prostatectomies, so we can do the complex as well. And I think sometimes it's best for people to see it. So I would highly encourage that they reach out. And the only thing I would say is they may have to be a bit patient. As we're going to be very deliberate in our commercial strategy, but we want to get to those markets. We want to serve the markets that we're not serving today, but we have to do it in a mindful way so that we have a long runway as a company.
Perfect. I'm sure if they put in Dexter or they put in DistalMotion into Google, it'll send them straight to your website, and you'll be able to.
Yeah, maybe you can flash up my cell phone number, but I'll
do that. Yeah. They can get on WhatsApp. So, final question, and not necessarily specific to DistalMotion and Dexter, but we have seen monumental shifts since the 90s all the way through. We keep seeing these shifts in surgery. In the next 10 years, what do you think are some of the big themes that we're going to see in minimal access surgery that are going to be the big changes, the big things?
Yeah. I don't think yet that anyone's really mastered the digital. And so these tools are data points. They're data access points within the surgical environment. And again, I think people are doing basic things, but we're really not leveraging the tools digitally in the way that we should. And I think that over the next 10 years, you'll see a larger penetration of robotics. There's no question in my mind about that. When you're talking about general surgery, and you see 10 to 15% penetration, that could be upwards of 50, 60, 70% if we have the right solutions. But what we're not seeing is really how we raise the level of care with all of these adjacencies and digital tools, which will be integrated into the products that you see today, but more in a meaningful way. How about you? What do you think?
Yeah, I think that the whole digital piece and getting insight from it is going to be the big thing. Actionable insights. Still, the most difficult thing I see with any of that, though, is that you're dealing with a lot of very complex healthcare systems that just are so hard to change. Even if they know what they need to do, getting them to change is the hard piece. So something's got to come out about how do you make it easier for people to act on the insights and the information that you give them. And then the second thing that I think is a big thing, and it's interesting that you say you're an open system. Is vision systems. I think there's going to be leaps and bounds in vision systems in the next 5 to 10 years. I know already 4K full color ICG is coming through and things like that. So, vision systems. And I think one of the advantages you'll have if somebody comes out with a nice new vision system, you can integrate it straight into your open system.
Yeah, in fact, at Sages, I saw quite a few that are coming. Where yeah, the ability to see what you can't see with the human eye. And obviously, there are great companies that do it now, but I think we're just at the forefront of that type of stuff, and I think it will become less invasive too. Now we're using injectables and things where you'll see more of this digital component, but I still think back about, if you're talking about the type of care someone receives in London or in Cleveland, Ohio, versus the type of care they receive in Tibet, as just picking a city out of the blue, we can raise that level of care with these tools, both robotic and then digital tools, so that someone, no matter what market they are in the world, they're receiving the same kind of care that they would receive at a world-renowned academic facility. And that to me is should be our mission over time. Is, again, to your point, to provide actionable information, not too much, the right information to help surgery get better across the world.
Yeah, excellent. Agree. I think we can see an improvement generally everywhere because knowledge and information can share a lot easier through the digital pathways. Well, look, Greg, I know you're busy, so I want to thank you very much for coming on, and thank you very much for telling us about Dexter and DistalMotion. It's been fascinating, and yeah, have you on again soon, and you can give us an update and tell us what you're about.
Yeah, love it, Stephen. Thanks for what you're doing for the industry. I think you're keeping everybody honest. I love your articles. I love your work. So I'll be happy to come on anytime.
Thanks. Talk to you soon. Bye bye.
I'll talk to you.